In the 1970s, a mysterious illness began killing puppies around the world. What seemed like a simple stomach bug turned out to be one of the most contagious viruses ever found in dogs, parvovirus. The disease causes violent vomiting, bloody diarrhea, and extreme dehydration. At the time, many dog owners and even some vets thought it was just bad food or an intestinal infection that would pass. But parvo was far deadlier. Left untreated, it could kill within days. Even today, without immediate veterinary care and IV fluids, the survival rate is very low. Vaccination has saved millions of dogs, but outbreaks still appear where dogs are unprotected. Canine distemper. Before vaccines, distemper was known as the dog plague. Scientists once believed it was just a type of flu, but it turned out to be a virus that attacks multiple systems at once: lungs, intestines, and even the brain. Dogs with distemper often developed tremors and seizures as the virus spread through their nervous system. For decades, many people thought these seizures were simply epilepsy, not connected to infection. Because of this misunderstanding, countless dogs died. Only later did researchers confirm that distemper was the cause, and the creation of the distemper vaccine became one of the most important achievements in veterinary medicine. Rabies. For centuries, rabies was surrounded by myths. Some believed it was caused by evil spirits or bad water. In reality, it is a viral infection of the brain that causes aggression, confusion, paralysis, and seizures. Once symptoms appear, it is always fatal. Rabies doesn't just threaten dogs. It can spread to humans through bites. That is why rabies vaccination became mandatory in most countries. Seizure disorders. For years, owners and even some veterinarians saw seizures as fits that would pass, but science revealed how dangerous they really are. A seizure lasting more than 5 minutes can cause permanent brain damage or death. Today, medication exists to manage epilepsy in dogs, but untreated, it remains a silent killer. Bloat. Among large dog breeds, there is a sudden condition that strikes without warning: bloat. In the past, many thought a bloated stomach was simply overeating or indigestion. In truth, it is a deadly emergency where the dog's stomach twists and traps gas inside. Blood flow is cut off, and organs begin to shut down. Without immediate surgery, dogs can die within hours. Kidney failure. Dogs have been poisoned by common household items for centuries, but the link between toxins and kidney failure wasn't always understood. Grapes, raisins, antifreeze, and even some medications can shut down the kidneys. When that happens, waste products build up in the body, leading to vomiting, weakness, and sometimes seizures. Before modern diagnostics, these cases were often mistaken for general illness. Heartworm disease. For a long time, owners believed worms were only found in the gut. The discovery of heartworms shocked the veterinary community. Foot-long parasites living in the heart and lungs, slowly strangling a dog from the inside. Dogs with heartworm disease developed coughing, fatigue, and sudden collapse. By the time symptoms appeared, it was often too late. Cancer. In older dogs, one of the most silent killers is cancer. Hemangiosarcoma, for example, can cause internal bleeding with no warning signs. For decades, sudden collapses in older dogs were often blamed on old age. Only later did veterinarians discover that hidden cancers were often the cause. Even today, some cancers spread so quickly that by the time they are diagnosed, treatment is impossible. Poisons. Chocolate, onions, xylitol, and sugar-free gum. Many common foods are harmless to humans but deadly to dogs. For centuries, sudden deaths after eating strange foods were dismissed as bad luck. Now we know these toxins can cause seizures, organ failure, and death even in small amounts. Prevention and owner awareness are the only true defenses.